Hello, I'm JP Venoit, President and CEO of Masonicare. On May 1st, we learned that a resident of the Masonicare Health Center tested positive for COVID-19. The resident was immediately transferred to our specialized isolation unit where they are receiving care. This unit allows residents to receive care in a safe and supportive environment while mitigating the risk of exposure to other residents of our community. This is our first positive test of a resident in our long-term care facility, and while it's unsettling, we want to assure you that as an organization, we are committed to the health and safety of our residents and employee team members. On May 4th, we received positive test results for a resident at our assisted living community at Masonicare at Asher Village. The resident who had been admitted to the hospital has been discharged to our isolation unit. Out of abundance of caution, all neighboring residents to anyone who tests positive at our communities are also tested for COVID-19. Residents with positive results will be immediately transferred to isolation where they will be closely monitored and cared for. While this is a challenging and extremely stressful time for all, I want to reassure you that all of us at Masonicare remain committed to the residents in our care. I was recently joined by a well-known friend of Masonicare, Dr. Ronald Schwartz, our Medical Director. First, I'd like to publicly thank you for your leadership, now more than ever. These are truly unprecedented times, and we are all so grateful for everything you and your team are doing to keep our residents and patients safe. Dr. Schwartz, I have a question that I'd like to ask you. And that question is, where do we stand with this COVID-19 pandemic?
Well, actually, I think we stand very well. I think it would be unrealistic not to expect some cases that would be present in the health center and other areas based on the infectivity and the aggressiveness of this virus. But all in all, I think we are well in control of things, and most patients are doing very well.
One of the things that I will tell you I'm extremely proud of is the dedication and hard work of all of our staff. You're on that floor. You're on that isolation floor taking care of really those that have come down with COVID-19. It must make you proud to see what they're doing for all those residents that we're entrusted to serve.
Absolutely. I was on the isolation unit earlier today, and the staff are just such professionals and kind people that are in control, and they're really doing the work. I go in a room and examine a person, but they're the ones doing the real hands-on care, and again, and you could see in their face that they actually enjoy it, that they're giving things of themselves that they want to be there, and it's an honor to be part of it.
One of the things that's associated with COVID-19 is the higher mortality rate of those over the age of 60. Can you kind of talk a little bit about what's attributed to that?
Sure. And maybe I'll just say one thing briefly, just that, it's interesting that when this pandemic first came about, there were certain signs that you'd look for, people that traveled to endemic areas, people that had sore throats and fevers. And what we're seeing now, and particularly in older people, is that there's a whole different series of symptoms that you see. And what you really see is older people don't follow typical symptoms. They may just become weaker. They may not eat very much. We call it a change in mental status. And a lot of that is just, as you get older, your body changes, your immune system weakens, people have multiple other comorbidities and other medical conditions that do make you more susceptible to a virus such as this.
Dr. Schwartz, you are really the medical director for our entire system, if you really think about it. You deal with our home care company, you're dealing with our residential living, our assisted living, and all of the system is dealing with COVID-19 in many different ways. How do you see the the medical system or the healthcare system of Masonicare addressing that?
Well, I think one of the things I'm most proud of, shall I say, is our coronavirus task force. And we've had this task force in effect. I think it's 2 months today that we had our first meeting. And this compiles all kinds of experts and people with their own talents and special abilities all across the continuum, from home care, from finance, medically, and we supply, and we put all our thoughts together to come up with plans to stay ahead of this type of pandemic. And I personally have always felt we were way ahead of it, not being chased by it, not being worried by it, but sort of waiting, like, bring it on. We're here, and we're always 2 steps ahead. And when you feel like that, you feel in control, but you really feel proud of a team of professionals that give you something that you'd never find anywhere else. Maybe I could say one quick thing, just sort of to follow that up. One of the things I'm most proud of is that I am a donor to the Masonicare Charity Foundation. And one of the nice things I get is a little calendar, it's a year calendar. And each day, and I've had this for a few years, each year, a new calendar comes out. So each day, some days are more stressful than others, but most days are pretty stressful. I go in my office, first thing I do is I peel the next day off and I read what the message says. And even my friends across the hall, medical records, will sometimes see my door open. They'll come in, all right, what's the message for today, and whatever. And I found one message that to me kind of sums up how I personally feel about all the people that I work with at Masonicare. So I'm going to maybe read it to you if I can. So it's a simple quote, but it says, "There are no problems we cannot solve together, and very few we can solve by ourselves." And that's pretty much how I see everything. We're a team, we work together, and we're way ahead of the game.
That's so true. I talk a lot about our puzzle, the picture of our organization, and every piece of the puzzle is us. And missing a piece means we're not really truly representing that picture. And you're absolutely right. I think having that ability to have a cohesive team that's really rowing all in the same direction has made a significant difference in how we're handling the COVID-19 virus. And you, as one of the leaders of this organization, I think really embodies why we're able to really address the COVID-19 virus. And that's why people are recovering. And this week, you're going to start seeing the state of Connecticut surveillance report talk about the recovery. Can you talk a little bit about the recovery and what we're seeing?
Sure. Well, as much as you hear negative sides of things, and there's no question this is a very serious virus. And I've never, in 40 years of practicing medicine, it's hard to believe it's 40 years, but I've never seen a pandemic before, and I hope I never see it again. But surprisingly enough, the majority of the patients that we're caring for are actually fairly stable and doing pretty well. They're not having a lot of respiratory symptoms. They may have some low-grade fevers, but their oxygen levels are good. Their chest x-rays aren't showing major changes. So it's far from a death sentence. Certainly something to take as fully seriously as we're taking it, but also to realize that many people recover, particularly, and older people are recovering. And I think that's something to understand and to realize that I think we're still going to see that more and more.
It's interesting. Today I actually went up to Asher Village, and one of our residents was actually on her way back to her apartment who had just seen you. And I asked her how she was doing, and she said, this is probably the best place for me to be. I feel safe, I feel secure, I feel like I am being taken care of, and if for some circumstance that I get sick, that I know I'll be taken care of. I just left Dr. Schwartz, and he has been somebody that's been able to make sure that I'm able to stay as independent as possible. How do you attribute that you're able to really get to our residents the way you do? Because the system, Masonicare does an absolutely fantastic job in making sure that we're taking care of our residents, but it all comes down to the individual person that's in front of our residents, and you are one of those leaders that's in front of it, and you can clearly see the residents have a comfort level in what you do, and a safe, in some instances, they feel safe, that you're their safety blanket.
Well, that's a very kind thing to say, and I appreciate it. And what's interesting is our medical office was closed for a few weeks just to protect everybody and make sure that there wasn't any chance of cross-contaminating or doing anything to put anybody at risk. But so I thought, well, I'm going to come down today and start the office, and most people probably won't come. Talking all around different medical offices that they're doing telehealth, and very few residents would come down. I had almost 10 people today that came down, and they came down because I think they just trusted the system, and they didn't feel that they knew that we were taking all the steps that we needed to do to keep them safe, as you said. And I think it's a lot of working as a team. It's the same as a team in the office. I respect the staff that we have. I value what they do, and I respect the residents. And I guess people know that you do respect them, and you care, and you want the best, and you're taking the steps needed, all of us, to protect them. You get 10 people, older people, coming to an appointment where, it was nice to see them as well, like family.
Well, one of the things you hit on that I think is interesting is this virus has created I would say inconvenience for normal life. You're seeing it, but how do you see that disruption, I think, make for a better delivery of healthcare?
Well, I think one of the things that came from this pandemic and so forth is I've met a lot of people. I haven't seen some people on the coronavirus task force, or even people I work with, but it's funny, like you start to rely on each other. There's a certain spirit that you just don't see very often. It's like you walk into the health center and you'll see hearts all over, and hearts will have messages to different staff members, and it respects everybody because it's a team effort, and everybody is really working together to make us do as well as we are doing to fight this and to get through it, and we will get through it.
I actually had a meeting with, or a video conference with some students at the local university. It was actually their last day of school. And my discussion with them was about leading through adverse times. And obviously this is probably one of the largest crises that I've been in my life. As you said earlier, it's your biggest that you've dealt with. But one of the things that I told the students, and I truly believe, is leaders come out during challenging times. And it's not about the titles, it's about the individual being the leader. And you talked about the task force, and you talked a little bit about going to some of these campuses of Masonicare. And I see that. I see leaders that are working every day making a difference, just like you. And I think one of the things that I've been extremely proud of, I just celebrated my 30th year with Masonicare, and to see how the organization has blossomed during this difficult time has been truly amazing. You've been here a very long time. The organization has changed dramatically. How do you feel that this organization has been able to adapt the way it has to address this pandemic?
Well, the nice thing, and I'm glad I can work this in, next month it'll be 25 years for me, so that's a big milestone too. And I think, what we see is we just have such a nice, diverse group of people that all have different types of talent. It's not just about medicine or nursing. It's about dietary. It could be about getting the right kinds of equipment, personal equipment for people. Just making policies up so we know what to follow and what to do, and infection control policies. I mean, every member of the team, the task force, and every member of the staff in general has their own unique contribution. And I think there's enough diversity, flexibility, and talent. And like you said, I think which was well said, the times that are the most stressful and put the person, that's where what they're really made of, who they really are, comes out. And it's like, I'll just say this, like, it's not often you get to take care of people in their upper 90s. And there are people that I take care of when man was at the Battle of the Bulge. And I don't know, part of a medical exam, you look at a person's legs and their feet, and I look at feet a lot. But I'm thinking these are the same feet that were at the Battle of the Bulge, and this man was now 98 or something. He was 20, 21 then. So you think about, just who you're taking care of and what it took. And in that generation that helped us to become our generation, I mean, these were the people that fought for us. And in a way now we're kind of giving back and fighting for them. And I think that's an honor that, you can never get paid back more for it than that.
And I think that's one of the things when we talk about COVID-19 and the virus, this generation is not expendable. This is a valuable generation that has given so much to us, not only as a nation, but also personally. And we should never forget that, and obviously you haven't. I would like to thank you, Dr. Schwartz, for really being candid and having this discussion today. It is truly an honor to be here with you and hear really your passion. And you as a leader, I think, allows Masonicare to really be able to do what it does. Thank you.
Well, thank you very much as well, and I appreciate the opportunity to speak with you.
On a bright note, I would like to thank everyone who attended our Smile Parade. It was a tremendous show of appreciation for all the frontline workers in the greater Wallingford community. We're grateful to all those who came together to honor these everyday heroes who are working tirelessly to care for our loved ones. The parade also kicks off National Nurses Week. I know you join me in celebrating our dedicated staff who show us the true meaning of compassion and bravery. My heartfelt thanks to you all. We are Masonicare Strong. Stay well.